my name is Stephan Duparc and I am the Chief Medical Officer at MMV.
My name is Isabelle Borghini and I'm a Senior Director in Product Development at MMV. The biology of Plasmodium vivax malaria is different from that of Plasmodium falciparum in that it has a dormant form in the liver that can reactivate and that can cause a lot of transmission again. So this specificity of its biology makes it a real challenge. And the burden in children is really high.
Vivax represents a big burden, particularly in Southeast Asia, in the Horn of Africa and in South America. There is more than 4.5 million of malaria cases that have been reported in 2020 due to vivax malaria.
Children are not small adults. There are really anatomical and physiological differences that can affect the metabolism and also basically the pharmacokinetics of new drugs. So they really have to be tested in children to ascertain the right dose. Tafenoquine. Tafenoquine is a single dose radical cure treatment for vivax malaria to be given with the blood stage treatment chloroquine. And we have worked on a pediatric formulation specifically addressing this need. And this was a collaboration between MMV and GSK.
The first step of the development was to do a phase 1 study to check the safety of the dose of tafenoquine that can be given. Then we had to do a phase 2 study to check an acceptable efficacy within the tolerable dose. And following this phase 2 study, you have to do a phase 3 study, which is a bigger study, to confirm the first results that you got in the phase 2 study.
Tafenoquine is a single dose cure and it's a dispersible formulation, so it's easily administered to those very young children.
A dossier has been completed and submitted to the Australian agency in 2020, and we got the registration in 2022. And the second step and the most important step now, it's to obtain registration from an agency where malaria is a problem, because what is needed is to have a drug that can be used by people suffering of vivax malaria.
Once it's approved by regulators in the disease endemic countries, it will need to be included in the feasibility studies that are being led by our colleagues in the Access and Product Management department at MMV. They currently have a study running in Brazil, and they soon will have one running in Thailand that tests the feasibility of including tafenoquine as part of the management of vivax malaria. Vivax malaria in children remains a significant public health issue, and tafenoquine pediatric should contribute to save lives.